So let's talk about the anatomy of the TMJ joint. I got my nice little skeleton here. So the TMJ joint is a hinge joint connecting the mandible and has a mandibular condyle sitting in the temporal fossa. So now deep in that fossa, there is a disc that sits, and that helps with shock absorption in the jaw as well as helping with the movement of the jaw. So the TMJ joint is a hinge joint. So the first around 20 degrees is going to be a roll, and then the rest of the motion is going to be a glide forward. So now ideally, the disc will sit in between that condyle and help it glide forward, but sometimes it can get eroded or it can move out of alignment, or maybe there's some arthritis that is damaging the cartilage in that area, and that can cause popping, clicking pain as the condyle is forced to roll over that disc in order to sit nicely or to open the jaw. Another thing that can happen is if that disc gets displaced, which usually it's anteriorly that it gets displaced. If that condyle is not able to pop up and over it, then it can get kind of stuck and it can be very painful, and that can cause some lockjaw as well. Now, the muscles that are in charge of the motions of the jaw, we have depression, elevation, protraction, retraction. So that's kind of the getting that underbite or overbite. And then lateral deviation. So the temporalis muscle and the masseter muscles are the two biggest muscles of this joint. They're the cause of a lot of our pain. So right up in here and then right on the outside there. And those are responsible for elevation and retraction, so getting it to sit really tight in that joint. Protrusion is going to be the lateral pterygoid, and that inserts right in here and goes up front, kind of joins on the bottom here. So that's going to help with that forward motion of the jaw. Kind of became detached there. It's going to help with that forward motion. And then the medial pterygoid is a little bit bigger, and that comes kind of in the same area, is going to help with elevation and protrusion of that joint. Now for depression, we're looking at the hyoid muscles and the digastric muscles that attach onto that hyoid bone that would sit right down here, and that's going to help with that depression of the jaw.